Hi, this is Dawn Rustrom at the State Unit on Aging. Thank you so much for joining us today for the ADRC Options Counseling Survey webinar. Before we get started, I just want to do a sound check to make sure that the audio is working and that everyone's able to hear. If someone could enter into the question box, perfect. It looks like we can hear. Great. Well, thank you so much for joining us. I'd like to at this time hand this off to Christy Murphy, our Interim Manager of the State Unit on Aging, to get us started today.
Great. Thank you, Dawn. Hi, everyone. Thanks so much for joining us today. As you know or may not know, we are we are working to build a business case around the ADRC. Gone are the days of us telling our stories about our good work and the impact it's making on consumers. Now we really have to, the time has come that we now have to really talk about costs and benefits and what the impact is on the consumers. And that's why we're embarking on this work. The survey might take you a lot of time, and it's maybe a little difficult, but it's really critical to the work we're doing. And we thank you for being willing to do this work. It's nothing that others haven't done. And so today we're going to walk through the tools and give you the information you need to complete the survey. It's going to be presented by two of your peers, Katie Tilton and Tanya DeHart, along with our partners at Compelling Reasons. We'd like to encourage you, if you have questions along the way as you start to fill this out, to reach out for, we'd be happy to answer anything you have, so to ensure that we're getting responses back that are correct, and so you don't have to go back and do things again. So again, thank you so much for being here. Thank you to all who are participating in making this happen. We appreciate it very, very much. And with that, I will pass it to Bruce.
Thank you, Christy. Hi, this is Bruce Hamilton, Compelling Reason, and I also have on the call today my two colleagues, Kelly Jensen and Mark Chussel. And so we have been engaged to conduct this study, and this survey is a key input to the analysis we'll be performing. So what we have is a PowerPoint presentation that supplements the materials that you should already have, and those include the survey itself, which is a Word document, and then there's an Excel document we call the checklist tool that you can use instead of or in addition to the Word document to complete your survey. So there are 6 questions in the survey, and so what we have is 2 or 3 slides on each question. We'll go through and give some examples on how to fill out each one. So let's move on to the first question. Now you'll notice this slide here, if you can see it, is it's got 3 parts to it, A, B, and C. And in all the questions, there's the A question, which asks how many consumers apply to this question. Okay, and then the B part is the guts of the question, and the C part asks whether your responses are based on records or your memory or both. Okay, so that's the general pattern here. So the first question deals with long-term care and living situations, and the idea is that this is a category where based on interviews we've identified this as a major area of benefits that options counselors create by convincing consumers to delay their decisions to move into either nursing homes or other institutions. And so you can see the table asks for, well, the first question is how many people did you even talk to about this question of long-term care? So it's just a count of numbers of people through the calendar year 2017. So all questions apply to the calendar year 2017. And then the question then is, of those people that this question applies to, how many of them apply to each of these 3 categories of delaying from home to a nursing home, delaying from home to another institution, or delaying from another institution to a nursing home. And so each of those, or the bottom one is, well, we really didn't make any impact at all. The consumer had some idea in mind, and is probably going to do the same thing after the guidance, after our counseling, is going to do the same thing. So that's where the no change would apply. And so how are we going to use this data? We're going to, for each of those situations of delay, we have estimates as to, what is the cost of a nursing home versus other institutions versus staying at home. So we end up subtracting the two columns, or basically taking the percentage and multiplying it by the average delay. And so this is one where you might have to do some guessing, okay? And, your records may show, how long it took them or how long they were planning to stay at home or another institution. Generally, that's the kind of thing that probably wouldn't be in your records. So we're asking you to just guess, to rely on your memory of the case. And so that would allow us to quantify it, and then we multiply that times the dollars per month of savings. And so the next slide shows how that works in the checklist tool. Okay, so the checklist tool, if you've seen it, has a lot of columns and a lot of rows. Okay, so this is just a few of the columns, so those columns that apply to question 1. And then as far as the rows go, we've got 5 hypothetical consumers. And the data that is made up for those consumers. So consumer 1 is someone that, after the counseling, decided to delay his or her entry into a nursing home by 3 months. And so the 3 gets entered in the first column, and then the next consumer had 4 in the next column, where they delayed by staying in somewhere other than home before going to a nursing home. And you see how those get added up at the bottom. There's column totals, and then those counts get converted to percentages in the blue boxes. And the blue boxes are calculated fields that then get transferred down to the survey itself. So you won't need to calculate those. You just need to enter the raw data. And then the survey itself is shown in the bottom box. You can see the percentages on the left column and the average delays. So those, for example, in the first column, there's 2 consumers that apply, and that's a 3-month and a 9-month, and those average out to 6 months. So I'm going to now turn this over to Tanya to go through some real life examples on how question 1 might be answered. Slide.
Great, thank you. So here on slide 4, question 1, we have a fairly typical example that we find here at Northwest Senior and Disability Services of an options counseling consumer that staff might work with. So in this example, the options counselor met with the Johnson family. They were seeking long-term care options for their mother, Helen. Helen's doing pretty well. She's residing in her own home. She needs a little bit of assistance with bathing, medication reminders, meal prep, and ambulation outside the home. I think as we find somewhat regularly, Helen's adult children had heard about assisted living. They knew someone who was in one. They really, really wanted to see her move into an assisted living facility for safety, because they're really concerned that she's had some previous falls and she forgets to take her medication. So the options counseling talks to the family about the range of options that are available, the cost, and the type of care provided through each option. And then Helen and the family really decided that after speaking with the options counselor that it would be best to bring in additional in-home care and supports that the options counselor talked about. And Helen was going to be just fine staying at home with those additional supports versus moving into an assisted living facility like the family and Helen maybe had thought previously would be a better option. So when the options counselor followed up with them, Helen's doing great in her own home with the additional supports and really doesn't have any plans to move elsewhere at this point. So in terms of how we would fill that out on the worksheet, because of the OC intervention, Helen delayed entry to another institution by staying at home longer. So the categories that Bruce had just mentioned, it would be the third category in. And then in terms of the length of time, the OC saw Helen and the family in April of 2017. So we're just going to consider that that was an 8-month delay. So considering a time from April 2017 through December 2017, because again, the survey is looking at the calendar year. So we're going to say at a minimum, that OC intervention delayed alternate placement by 8 months. And this should be pretty easily found within the care tool and looking at the progress notes and also at the assessment and then the follow-up notes. As was brought up in the first webinar, some people have access to Oregon Access and other databases that may have additional information that could absolutely be used to help inform whether or not there were any changes from the time when the OC did their last follow-up and when you're in the end of the calendar year of 2017. So hopefully it should be pretty easy to find the information. Staff here at Northwest are finding it takes between 8 and 10 minutes per consumer to work through the survey. So definitely some time commitment, but worth the effort. So thank you.
Okay, thank you, Tanya. So I'd like to ask if there are any questions related to question 1, and you can enter your questions into the chat.
So this is Dawn, and I apologize in the beginning. I forgot to mention that throughout this presentation, you're all welcome to use the question feature to ask questions as you go, and then we'll pause throughout to respond to them and then try to cover any remaining ones at the end of the webinar as well. So far we have 2 questions submitted, one for Tanya and one for Bruce.
Okay, Tanya, would you like to go first?
So what I see here is it's more of a comment, I believe, than a question, and it reads, people don't generally decide to enter a nursing home without an unpredictable crisis driving the decision. And that is sometimes the case. I do know that actually as staff have been completing this survey, they had a couple, at least each of them had a couple of examples of folks that were intending to move into a nursing facility for whatever reason. So I think that's kind of what we're getting at. It could, in many of these circumstances, it could be a variety of different reasons of why they're seeking care. But certainly, I think folks are going to have at least some that were looking at a nursing facility prior to speaking with an options counselor.
Okay, great. And I have a question that says, how does guessing produce viable data? And that's a great question. So the logic is that currently we don't have any data, we don't have any information at all, and therefore there's no basis for any benefits. But this survey and the reasoning for asking you as counselors to give us your estimates is that you are in the best position to give those estimates than anyone else. If you didn't estimate, then we, as the analysts and the consultants, would have to estimate, and we certainly wouldn't know, for example, how long any person might be delayed. So the idea is that with all of the data that will be collected, some will be based on actual records and some will be based on estimates, but there'll be hundreds of responses collectively from all of you throughout the state, and that provides enough meaningful data to have the analysis make sense. Okay. I think that might be the last question. So let's move on to question 2. Question 2 is the simplest one of the 6 questions, and it's basically a count. The category is care transitions. Okay, and the idea is that the care transitions program helps to prevent hospital readmissions. So we have data that would enable us to convert the number of consumers that enroll in care transitions to hospital readmissions, which has a dollar value. So the question is, how many? How many people did you talk to on and convince them or help them to enroll in care transitions? And here's what it would look like on the checklist tool. Just basically, you enter an X or nothing. X if if that applies. Okay. Now, recognizing that there are parts of the state that probably don't have the care transitions program, so this question wouldn't apply to those people. But any questions about question 2 that came up on the chat?
Nothing so far. Oh.
Nothing so far. Okay, then let's move.
I'm sorry, this one. Somebody's asking if you can explain the care transitions program, and I'm wondering if maybe Tanya or Katie or Christy might want to take that one.
This is Katie. I'd be happy to just give a quick summary of what care transitions is. So in the metro area, we work with our local hospitals to provide a 30-day follow-up for people who have been hospitalized for specific health conditions. So we do one home visit and then several follow-up phone calls over the course of 30 days to reduce the chances of them going back to the hospital. So if you're not sure if you have a care transitions program in your area, you may just want to check with your supervisor or SUA liaison.
Thanks so much.
Okay, thank you. Let's move on to question 3. Okay, question 3 deals with housing options, and the logic is that the benefit is that that you as counselors are helping people to avoid becoming homeless or to be evicted from their homes. So it's a really a count of those. First of all, question A is how many people did you even talk to about this category, and then of those people, how many? What was their situation before they came to you, and then within 90 days after? And so what we're looking for is, of course, changes. People that are in the other category, which is basically having a home without being in risk of eviction, et cetera. The idea is that we would have an increase in that one. That would translate to a benefit, as seen in the box at the bottom. That we would take the number of consumers, multiply by the percentage change between the two columns, and then we have a dollar value for what housing cost would be in terms of the savings, and then times the number of months. We'll have an estimate for that. And the next page shows how that would look like in the checklist tool. Here again is 10 or 5 hypothetical consumers where this question applies to. And really what we're looking for here is either an X or nothing. In each of the 3 columns, the 3 columns on the left side are the before picture, and then the 3 columns on the right side are the after picture, after guidance. And you can see they get added up and converted to percentages in the blue box, which gets translated to the table at the bottom. Okay, so let's now turn back to Tanya, who can give us some real-life examples of question 3.
Great. So for question 3, the case example that you have before you, options counselor met with consumer George. George is living with his son, and the son really wants him to move out, and was really feeling that he needed to probably seek care setting, because that's what seemed like the right thing to do, and that was the advice that the son was giving. So George met with an options counselor to talk about different options that are available. He's actually entirely independent, rides the bus to the community center to eat lunch, visit with his friends, take classes. In meeting with George, the OC talks about the different needs and preferences, ultimately discussing and giving resources related to low-income housing because George didn't have any care needs, so he was really independent. Apartment type setting was going to be the most appropriate for him. At follow-up, George had moved into his own apartment, moved out of his son's place. So in terms of how to capture this, because the consumer was facing eviction, albeit a different type of eviction, because it's not maybe a formal notice, having lived with a family member, but we have seen this a number of times where it really became a fairly dire circumstance where the family really wanted the person out of the home, and it wasn't a good situation for anyone. And so in this instance, he was really facing eviction before receiving the ADRC guidance, and then 90 days after receiving the assistance from the options counselor, he was in an apartment. So we'd go ahead and mark an X under the other column because he was facing eviction prior to meeting with the OC, and then was able to get into an apartment after meeting with the options counselor. One of the questions that has come up around this was whether or not it needed to be like a formal eviction notice or just facing the threat of eviction, and the clarification was it's really facing the threat of eviction, so not necessarily a formal written notice would be needed. Thank you.
Okay, thank you, Tanya. Dawn, are there any questions on question 3 that have come up?
No questions so far.
Okay. Okay, very good. Let's move on then to question 4. Okay, question 4 deals with falls and fall prevention. And there's a benefit in preventing falls in that the falls result in hospitalization on occasion and other costs. So we would translate the benefits. This is I'll jump to the box on the bottom. Total benefits are the number of consumers times the increase that attend a fall prevention class. And then we have some data that shows how fall prevention classes result in decreased frequency of emergency room visits. And then we have additional data that shows what the cost of an emergency room visit is. So all that translates to total dollar benefits. So the question we're asking is, well, first of all, 4A is, how many people have you even talked to about falls and fall prevention? And so that would include those that may already attend classes, even if they haven't yet fallen. So 4B then says, of those people or their family members, what percentage planned to attend a fall prevention class, which is defined pretty broadly. There's some examples there, but any kind of a fall prevention program that you may have mentioned to them. And then the 2 columns are before and after receiving your guidance. And after meaning, within 90 days or so. And the next page shows how that would look on the checklist tool. Again, here's 5 hypothetical consumers. Consumer 16 is the first one. He's someone that before coming to you was not planning on attending a fall prevention class. So that's why there's an X in the second column. And then after talking to you, he decided to take a class, and that's why there's an X in the third column. Okay? And so you just add up the X's and then convert those to percentages. And see, in this case, these 5 consumers, 40% were planning to attend before guidance, and that grew to 80%. So the difference between those 2 numbers is 40%, and that translates to dollar benefits for those people who were basically changing their plans to attend. Okay. And this time I'm going to ask Katie Tilton to give a description of a real-life example of question 4.
All right, thank you. So this is just one example that we came across in our case study. So call to Jane, the options counselor contacted the consumer. The consumer had reported that they had fallen while they were getting out of their shower and that they were having pain in their hips. So they went to the emergency room for x-rays, which didn't show any fractures. The consumer wasn't admitted, but she did express some concern about paying for the ambulance ride copay. And in Clackamas County, there weren't any resources available to pay for that. So we just talked to her about talking with the provider on a payment plan to see if they could work out a payment plan if the copay was more than she could afford. After her fall, she had purchased a tub transfer bench to help her with getting in and out of the shower. We talked about her attending a Tai Chi class at the local senior center and discussed other options for increasing her safety and preventing falls in the future, which included home health referral for a home safety evaluation and talking to her primary care doctor to see if a referral could be made to home health. So on the worksheet, the way that we would capture this is we would not indicate that she was hospitalized, but we would indicate that she did incur other costs associated with the fall, which included the copay for her ambulance ride, and she purchased the tub transfer bench because of that. She hadn't been aware of fall prevention classes before our intervention, and so I would indicate that she was planning on enrolling in a fall prevention class after receiving our guidance, along with the home health referral for the home safety evaluation.
Okay, thank you, Katie. All right, do we have any questions on question 4?
No questions at this time.
Okay. Very good. Of course, you can always ask later. We'll have time at the end for any questions that you have. We also have a Q&A document that you may have seen, and we'll update that to include any questions that come up today. Okay, so move on to question 5. And this is probably the toughest one or the most complex one. It's kind of a catch-all to pick up, how you have helped consumers to obtain assistance in a variety of areas. Okay, so you can see it includes financial aid, food, health, transportation, and other. Okay, so it's basically anything that you have done that results in the consumers receiving any of these items. Okay, so 5A is just how many of them fall into that category. 5B is splitting it out into these subcategories. And again, there's 2 columns, before and after guidance. Okay, and then there's a third column on this one, and this is probably the tricky part, is to estimate the dollar value or the incremental value of assistance that you've helped the consumer get. And so this is something, again, might be in your records, might not be in your records. But the logic here in asking you for this is that, we, in order to convert this to meaningful data, we need to, assign a dollar value. And you, as the counselor, are in the best position to give us that estimate. If we were to estimate, it would be probably less accurate than your estimate. So we basically multiply by the percentage of consumers that apply to each question, and then times the average incremental dollar value, times the number of years that it will be in effect, and that's an estimate we will add for each item. So you can see the categories there with some examples, and Katie's going to give you some more examples, okay, because there's lots of things that could be included here. I'll note that the other category, we did say let's cut it off at $1,000 or more, but the other categories could be smaller than 1,000. So we encourage you to put in anything that you can think of here, because of course the goal is to show as many benefits as we can. Of course, based on the actual data. So here's just the checklist tool. for question 5. You can see it's a little bit complex, but you can see, again, there's 5 hypothetical consumers where this might apply. And we've got 5 columns on the left and 5 columns on the right. Instead of X's, you'll see the actual dollar value. So consumer 21, for example, was receiving no assistance before coming to guidance, and then afterward, they got $2,000. So that's where the $2,000 came from. Consumer 22, they were receiving some food stamps of $500 before coming to guidance, and then they still were continuing to receive that afterwards. So there's really no impact by the guidance. So consumer 22 will net out to a 0. 500 minus 500. Okay. The others are more positive, but you can see they all get included in the average. There's the average and then the incremental dollars, and that's all calculated by the spreadsheet and then converted to percentages in the table below. Okay, so now back to Katie. You can give us some examples.
Okay, so I just tried to list some of the things that you might come across when you're looking at your narratives or in your action plans or in your assessments on the kinds of resources or services that you're providing information or helping your consumers get connected to. So this is by no means a comprehensive list, and just so you all know, you'll get copies of the PowerPoint, so you'll have this as a reference. So just be thinking about the kinds of things that you're helping folks get connected to, and do your best to fit them into whichever category might make the most sense. Do you want to go to the next slide? And I'm sorry, I think that there might be an echo, so I apologize for that. So just a few examples on some of the resources that we've helped folks get connected to. In a narrative, per organ access, the consumer was approved for QMB effective January 1st. So the way that I would calculate the amount to put into the worksheet is just the cost for the Medicare premium and multiply that by 12. Another was that we had confirmed that the consumer had been enrolled in Oregon Project Independence and was getting 15 hours a month of in-home care. So to quantify that amount, I would take the hourly amount for a home care worker and multiply that by 15 hours a month by 12, and that's the dollar amount that I would put into the worksheet. Another was we received word that a consumer had been approved for SNAP and that they were getting $16 a month. They had also been awarded a grant to help build a wheelchair ramp and get grab bars in her bathroom. And so for, I would enter the SNAP amount, multiply that by 12 for the food resources, and then for the community development grant award, I would enter that under the DME tab for $5,000. So the community development grant amount was $5,000. So it was a one-time award, so that's the dollar amount that we would put in. And then another example is helping one of our consumers get connected to home-delivered meals. So we helped them get connected for 7 meals a week. And so we just take the cost of the meal times 7 times 52, and that's the dollar amount that we would put under the food tab. And the last is for transportation. Clackamas County has a local volunteer transportation program called Transportation Reaching People, or TRIP. So we help somebody get connected for dialysis rides 3 times a week. So the estimated cost of the trip is $28 for a round trip. Multiply that by 3, multiply it again by 52, and that's your dollar amount for transportation assistance. One of the questions that came up in the other services that would cost over $1,000, the best I could come up with would be things like legal aid assistance. So if you're helping people get connected for estate planning or, you know, foreclosure avoidance, and you know that the cost of legal services is high, do your best to estimate that cost, and that would be where it would go in your other category.
Okay, thank you, Katie. Do we have any questions on question 5 that have come up?
I have one that was submitted that I sent to Katie.
Okay, give me just a second here. Okay, if the OPI client uses an in-home agency, would you use the hourly cost of the service in your calculation? Yes. So if you know that consumer was connected to an agency provider, I would use your hourly agency rate, multiply that by whatever the amount of hours are per month, and then there's your cost.
Okay.
All right, that's all we have.
Very good. Okay, that's good. Let's move on to our last question. Question 6 deals with abuse and neglect. Okay, so 6A is how many people have you talked to in the last year about abuse or neglect issues for themselves or their family members? And then the next part of the question asks you to split those consumers into two categories. One is financial abuse, and the other is all other. All other might include physical or emotional, etc. Financial, we're asking you then to estimate how many dollars were potentially at risk or potentially prevented from being taken from the consumer. Okay. So we'll give you some examples of that. So what we're going to do with that is multiply the number of consumers that it applies to by that the average of the financial abuse, and that will give us the benefits for this category. Okay, so here's the checklist tool for question 6, and then Katie will give some examples as well. But see, consumer 26 is one where they had $10,000 that were at risk, and you may have helped to prevent someone from taking that in some way. And this probably would involve adult protective services in some way, either you contacting them or they contacting you. But we would say that it doesn't matter what direction the flow is going, so long as you were involved in the ultimate positive outcome, we'd count that. Okay. So, and you see consumer 27 was 5,000 and consumer 29 was 15, and those three numbers add up or average to 10, and that's what gets entered down below under the average approximate value. And then on the all other types, we're just looking for a count on that. That's more difficult to quantify, so we're not asking you to quantify it, but just to count it. Okay, and so Katie, if you could give us the real-life example of abuse.
Yeah. So we were supporting an individual who had been awarded a pretty significant amount of money from a family member's estate. And in our work with this consumer, we had determined that there was some real risk for them of exploitation and a lack of capacity for managing their funds. So we assisted them in connecting with a local nonprofit for a conservator, and the conservator was put in place to manage that person's inheritance, which was $200,000. So for the approximate value of the abuse that was prevented, we would enter $200,000 on the worksheet. And then for any other referrals that we would have made for abuse or neglect, we understand that you may have limited access to the records for protective services. So depending on what you narrate and what you're able to see, do your best to recall any referrals that were made to protective services to capture that information if it exists.
Okay, thank you, Katie. And Dawn, do we have any questions related to question 6?
I submitted one to Katie. I think it was addressed, but you're welcome to elaborate.
Yeah, the question was, if progress notes cannot specify the type of abuse or neglect, are we going to go by memory and identifying financial versus other abuse? My answer to this would be yes. And if you can guess on the value of the amount of, if it was financial abuse that you made the referral for, if you know a dollar amount, like let's say somebody had $3,000 left in their bank account and a family member was accessing that bank account without their permission, you made the referral to protective services and that prevented that remaining $3,000 from being taken, then that would be your value.
Yeah, I would agree with your answer, and also maybe add another twist to it. If the consumer had Social Security benefits being added to that bank account, let's say they had a couple $1,000s a month, that I would count that as being at risk as well. And so 2,000 times, however many months in 2017 to add to the number. Okay, let's. I want to just. We have a little bit of extra time. I want to just pull up the actual survey document, and just to mention that one of the things we do when we receive this, we look for. We're going to take all the answers and put them into a master document, and then, of course, analyze the data. But some of the data we're receiving is not internally consistent, meaning that here's an example in question 1. We are asking for in the first column, 4 categories that should add up to 100%. So we're getting some examples where they don't add up to 100, and so that forces us to either guess or to have to come back to you to clarify. Another example was, we had an entry in the first row for percentage, but nothing in the second row for the delay, second column. And we had no entry in the first column for delay in the third row, but we had an estimate in the second column. So it wasn't clear to us what was going on, and so that's why we would have to either guess or go back to the OC counselor to clarify that. So we'd like to ask everyone's cooperation and paying attention to those kinds of things, both you as counselors, but also if any supervisors are able to look at the responses as they are completed and turned in. That would be appreciated. Let's see another example of that one. Here's another one that adds up to 100%. And there was in question 6 where they identified a number of people that were abused but didn't have the split between financial and other. And that's something that we would hope you could do. And that's maybe the nature of the question that was just asked, is that in all of these questions, if you don't have the data, we really think that you are in the best position to give the best estimate. So we're asking for your estimates. And that's why the purpose of question C is to tell us, well, when your memory was, you relied on your memory, you can check that box too, and we'll understand where all the data is coming from better. All right, I'm going to go back to the PowerPoint and show this final slide. And there was a question about, well, do you really want us to look at all of our consumers? And some people have quite a few consumers to go through. And so we think that that's a fair point. And so what we have come up with is, if you have more than 50 consumers, then we would say to go through and give us 50 or at least 50, and then as many more as you can after that. If you have less than 50, then we'd like to see the data for all of your consumers. And hopefully that it won't take so long to be an overly burdensome. Maybe you can spread it out, and hopefully it will get easier as you go. So we're asking that they be submitted by the end of the month and just sent by email to Kelly Jensen. And any questions you can submit to Kelly, and we'll do our best to get the responses back to you as quickly as we can. And finally, at the bottom, I would say with double underline and double exclamation points, thank you. Thanks for all you do on a daily basis, but also thank you for your input to this important piece of work. So, Don, do we have any further questions that have come up since?
We do. So I've sent a couple to you, Bruce, and then Katie, there was one comment I sent to you. I wasn't sure if you wanted to address that as well.
Okay.
Yeah, I'd be happy to. So someone who commented, I find that I provide more of these types of case management with OPI and OAA clients rather than my options counseling clients who are more self-sufficient. We work with our OPI and OAA clients much longer than options counseling and have more opportunity to provide more in-depth case management. And I would agree with that. And I'm happy to hear that, you know, the services are available to those that are needing longer term support. And my comment to this would be that this data is really for those that have been served in options counseling. So if as a result of your options counseling service, you can indicate that any of these, you know, data points were met, then that's what we're looking at. Understanding that folks will and often do move on to more longer term case management services. And I hope that helps.
Okay, and I have a couple of questions. One of them it says, if a counselor does not feel comfortable with their guesses, should they just breathe and let go? Can you please bless the guests? So this is a great question, and I think I think it's well stated. Yeah, just breathe and let go. The way I would put it is to say, you know, we really think that your guess is going to be the best day that we're going to get, and with the collective input from as many of you as there are, and as many consumers you each have, it'll be valuable data to us. So we would bless the guests. And then the other question is that 50 consumers per counselor? And yes, there are some of you that have well over 100 consumers in the year. And so we would say that if you could get to at least 50, that would be our ask. And that was all the questions I had.
And that's all that we have so far.
Okay. Well, and as I mentioned earlier, there is a Q&A document that that I know, Don, has that already been distributed?
I will follow this webinar once we have it updated to reflect the questions asked today. You'll all receive the presentation materials from today as well as an updated Q&A document and a link to view the recorded webinar as well.
Yeah, okay. I'm thinking if they had seen that Q&A document, that might explain why there are not so many questions this time. But if
it's possible.
Yeah.
We circulated the Q&A document from the first round through all the options counseling supervisors, so it's possible some of the folks on the webinar today have since seen that, but I'm not sure.
Mm-hmm. Okay. Well, I think we might be able to close a few minutes early. So I would just like to say thank you all again.
Great. Thanks, everyone. Have a great rest of your day.
Okay. Bye.